Um, we will be in touch, and thank you. I'd like to invite our closing panel. We have 14 minutes left of the forum, and this is an exciting time where we can help you think about your next steps. And I want to urge you to challenge yourself right now to think about, what are you going to walk away with? What are you going to do, particularly if you're one of our 4Ps that we've heard about over and over again over the last for 2 days together. What are you going to do? And what's your commitment to maternal mental health? And to help those of you who are still thinking, I'm not sure if there's low-hanging fruit, what should I do? It feels overwhelming and daunting. This next group is going to share some ideas. We're going to be talking about what's coming in May, Maternal Mental Health Awareness Month, and Maternal Mental Health Awareness Week. We'll hear about those opportunities. We'll also be talking about the Policy Center's report card that grades states, some of the updates that we're looking at. You won't be surprised to know that HEDIS is going to be a big part of the report cards this year. And we'll hear from Danielle, who's with us also from the federal government, about the federal government's national campaign around postpartum depression. Welcome to the three of you. We are going to pop up some slides. There we go. And I want to first turn it over to Danielle Augustin. We're so glad that you're with us, Danielle, from the Office of Women's Health. A lot of exciting things happening at the federal government around maternal mental health. Danielle, I'll go ahead and turn it over to you.
Hi, everyone. Thank you so much, Joy. I'm so excited to have the opportunity to be here with you all today. I'm Danielle Augustine. I'm with our Office on Women's Health within the Office of the Assistant Secretary for Health within the U.S. Department of Health and Human Services, talking about our postpartum depression campaign. Next slide, please. So our campaign aims to empower women to seek help for PPD by destigmatizing PPD through increased awareness of PPD symptoms, visibility of reliable resources, and understanding of ways to access care. So our campaign serves first and foremost women and parents who may be struggling or at risk for PPD, but we know how integral those support networks are. So we also have resources and messaging for family members, friends, other supporters, and healthcare professionals. Next slide, please. So all of the resources for the campaign can be accessed in our toolkit, which can be found at womenshealth.gov/talkingppd/toolkit. In the campaign and at the core of the campaign are video testimonials from women with lived experience. So we have 5 different amazing women from diverse backgrounds, all who have experienced, gotten help for PPD, and now chosen to share their stories as a way to empower and support other women. We also have a women's gallery, which has additional lived experience testimonials from women in written form. We have social media assets, which are graphics and sample social media messages to help you all share the word and start the conversation with your networks. And then we have a whole host of downloadable and printable content. We have fact sheets, we have posters, all of which to help our target audience of women and families, but then also those support networks as well. All of our resources are free. They are copyright free. They are printable, downloadable, and all of the resources are also available in both English and in Spanish. Next slide, please. So I wanted to give you all a sense of the voices that are at the core of the campaign just by showing a brief preview of one of the 5 women in the campaign and sharing her experience. So I encourage you all, this is just a quick snippet, go to the campaign resources and listen to all of the full stories. They're just so powerful and impactful, but I'll give you a preview of Clarissa's video.
When I finally had my little prize there, like I didn't feel like I had my little prize. I felt a disconnect emotion-wise, and I felt fear. It was just hard to admit to myself, even harder to admit to somebody else, and to speak the words like, you know what, I think something's wrong. I'm not perfect, but I am very much closer to where I want to be, and I'm happy about it. There are people out there that will help you, and you just have to look for it.
Next slide, please. And you'll see the call to action on all of our resources is the National Maternal Mental Health Hotline. So we've been working closely with HRSA to make sure that that is our main call to action to provide resources directly to that hotline for folks that may be struggling. So at this point, we encourage you all to join the conversation. We know that talking about postpartum depression this campaign specifically encourages women to share their stories and journeys as a way to empower other women who may be struggling to seek help and support that they need. So explore the toolkit, see what in there might be helpful to you, not only in your professional life, but potentially in your personal life as well. Find help and resources that are out there for you, the people in your life, the communities that you serve, support the women in your life. And if these messages resonate with you, share your story with the people in your life that you may feel comfortable doing so. We know that talking about it normalizes it, helps bring attention and awareness to these issues so that we can get better supports and services. So thank you all so much. I know that was very quick. We encourage you all to join us in May for National Women's Health Week, which will have a spotlight on maternal mental health. My contact information is here. And thank you again for the opportunity to speak with you all.
Thanks, Danielle. We're going to turn it over next to Laura Kilgore with the Blue Dot Project. Hi, Laura.
Hi, thanks for having me. I'm Laura Kilgore, the manager of the Blue Dot Project, which is powered by Postpartum Support International. We are the host of Maternal Mental Health Awareness Week, which is this year from the 5th to 11th of May. This campaign primarily focuses on awareness and stats and facts surrounding different maternal mental health disorders. Our theme this year is Storytelling Saves Lives, where we're encouraging participants to share their own story and help shine a light on not only their story and how they went through it, but the silver lining that comes along with it and how they're able to find their support. Next slide. The blue dot is the universal symbol, the national symbol for maternal mental health. So when you're thinking of the blue dot, you can compare it to the pink ribbon is for breast cancer. That's what the blue dot is. And we want to get that symbol out there and known so it is just as recognizable. Next slide.
I've got my necklace on. I had to share it, Laura.
Yay! So like I said, we're the host of Maternal Mental Health Awareness Week, and our theme is Storytelling Saves Lives, with the purpose of raising awareness and getting that symbol out there, known and seen, and combating our stigma and shame that surrounds it. With the theme of Storytelling Saves Lives, that's one thing that we hope to do is to break that stigma and shame surrounding it. We will have a toolkit that will be released April 1st. You can get that toolkit and be the first to know if you subscribe to our newsletter, which I believe that information will be in Whova, as well as you can find that on our website under the subscribe button. Next slide. So what we're asking is for moms, organizations, brands, truthfully anyone, to share our social media content, as this is a social media campaign, during the week, as well as taking advantage of the information that's in our toolkit. We'll have images that people can, and like text that they can share. Here's some images of past campaigns. And next slide. All right, that was my last slide. If you have any questions, you can email me at laurak@postpartum.net. Thank you.
Thank you, Laura. Now I want to introduce Caitlin Murphy, who represents our team at the Policy Center. Caitlin, turning it over to you.
Hi, everyone. I am so delighted to be with you here today at the end of a very fabulous forum. And I have the honor today of giving you a sneak peek at the 2024 Maternal Mental Health State Report Cards, which the Policy Center will be officially launching at a congressional briefing on May 2nd. Next slide, please. If you've been following the Policy Center's work, you might recall that last year, 2023, was the very first year that the state report cards were launched. And the report cards sparked lots of awareness and great conversation, which we're really looking forward to continuing this year. The 2023 report cards confirmed that the U.S. is failing U.S. mothers with regards to their mental health, with an overall U.S. grade of D, and 40 states and DC receiving a grade of D or lower. Next slide, please. If you haven't seen the report cards yet, they do provide a snapshot of state efforts to address maternal mental health across 17 measures in 3 categories. First, in the provider and program category, this category looks at provider-patient ratios and inpatient-outpatient programs. Second, the screening requirement category looks at screening reimbursement, screening rates, and progress on HEDIS screening measures. Third and last, the coverage and treatment category looks at measures related to Medicaid coverage, treatment rates, and maternal mental health quality improvement programs. Next slide, please. Since last year, states have been making great progress on several of these measures. For example, there was a new maternal mental health screening requirement for OBs put into place in Arkansas. There are new maternal mental health outpatient programs in Florida, Ohio, and Virginia. And importantly, we have a new measure that we're launching in 2024. For the first time this year, maternal mental health screening rates, as measured by the HEDIS dataset, are now publicly available by state, which is extremely exciting. So as such, we're now able to see the state screening rates for prenatal and postpartum depression as reported by private and Medicaid health plans into the NCQA. The states that are emerging as having the highest screening rates so far include California, Florida, New Mexico, Pennsylvania, Utah, Washington, and Wisconsin. So we'll be sharing much more on that during the official launch of the 2024 report cards in May. Next slide, please. In the meantime, we do encourage you to please save the date, May 2nd, and keep an eye out for registration coming up soon. While we hope to see you on the 2nd, we hope that you also do dig into your state's report card right now, the 2023 report card, prior to the 2024 launch. You can access your state's report card at 2020mom.org/state report cards. Again, thank you so much for being here, and I'll turn it back to you, Joy.
Great. Thank you so much for giving us insights around things that we can get involved in May. I want to thank all of you for joining us the last 2 days here with incredible content from experts in various fields that joined us on the main stage. I want to thank our sponsors, and particularly our champion sponsors, the Bezos Family Foundation, the Zoma Foundation, the California Healthcare Foundation, and Cigna for your investments in our work and this event. Recordings will be posted by early next week in Whova, and Whova will be open for the next 3 months. We encourage you to continue to network there, ask questions. Our speakers will be going back in and answering questions and dialoguing with you in the app. And today we're going to be sending you an evaluation. We want to know, what did you think about the program? Let us know by taking 2 minutes today or as soon as possible to tell us. And we also are asking that you tell us, what is your commitment in this next year to maternal mental health? Was there something that you heard that you wanted to take action on? Let us know in that evaluation, and we're going to be sharing some of your feedback in highlights that we will be posting on a blog summarizing the forum in the next coming days, and we will be pulling our favorite commitments from the evaluation. And last, I want to share that I know, like many of you, you're probably thinking, like, what do we do now? This was incredible information, so many moving parts. It's hard to get my arms around, yet I'm hopeful. And to help all of us do those very things, we're launching a campaign which we are calling the 15 by 30 campaign, with 15 aims that all of us can get behind to advance by the year 2030. So stay tuned to learn more about the 15 by 30 campaign, which we'll be sharing shortly. Until then, thank you for joining us at this year's Forum, Maternal Mental Health Forum, and we hope to see you all online at future events soon. Thanks all.